despite all our gee-whiz technology, it's hard to really replace an arm or leg, and we haven't figured out how to do that with a brain. There's no prosthetic brains that I'm aware of yet. So we, I think from the standpoint of, if you think about your leg and like how many pairs of shoes or socks or underwear you wear, like do you only wear one pair of underwear or one pair of shoes or, one coat for everything that you do 365 days out of the year? I'd have to say if you do, then okay, we got big issues. But I think the main problem here is that it's expensive, right, to issue them more than one device. And it depends on the scenario, so it's going to depend. So in certain cases, for lower limb, you can get away with a single primary device. And as that device sort of wears out and you want to replace it, that becomes a backup, and then the new device becomes their primary. When it comes to upper limbs, it becomes more complex. It depends upon the level of amputation, how many amputations. Is it one limb? Is it two limbs? But at the end of the day, especially for the hand and the arm, it's very difficult to replicate, and they may need more than one prosthetic device to accomplish these goals. And a lot of times we're talking about a body-powered prosthetic device, which is more cable-controlled, using the patient's own power versus an externally powered, such as a myoelectric device. They're probably going to need both. They're going to use certain ones for some tasks, and they use certain, and then they use the other device for other tasks, and they may even have interchangeable, what we call terminal devices or hands or hooks for one of the prostheses to do multiple tasks, much like, when you try and build something or repair something, hard to do with just one wrench and no screwdriver and no pair of pliers. So it's kind of like, you can't expect someone to actually have one device replace their hand. It's just not really realistic. So you have to look at it in a manner of, they may need more than one device. Some people may get away with 90% of their stuff with the one primary device, but they're going to need something else for the other 10%. And I think that's the piece that people forget when you're missing, especially when you're missing an arm or hand. It's really, usually we're going to start recommending multiple devices for that. So I know most payers are going to cringe at that idea, but this is just the reality. Let's face it, if you're trying to replace a hand, we can't really do that right now. It's not like Luke Skywalker, and his arm looks great, with his prosthetic control, and he can barely see it when he had his arm on. So I think that's, we're not there yet. They're actually getting some really great research out there to restore sensory feedback, because that's really the key to all this. We got great motors that can kind of do stuff for you, but there's nothing they provide that right now, the sensory feedback that tells you where your prosthesis is in space. And that's kind of the more important thing, or what you're actually picking up.